The next study is from Rome. Dr. Basso and his group from the University of Rome Sapienza are going to present early ghrelin and GLP-1 changes after sleeve gastrectomy in diabetic obese patients. Yes.
Because I can't hear.
No problem. It's the green button.
Good evening. We are going to present some of our data on sleeve gastrectomy and the hormonal changes that are induced by this operation. We have a total of 338 sleeve gastrectomies. 80% of these patients had type 2 diabetes. We will review some of the data that we got in these patients. 69 patients with a consecutive diagnosis of diabetes and obesity, with BMI between 32 and 48. All of them underwent sleeve gastrectomy. 60 of these 69 patients were cured, which means that they resolved their disease, that they got no more therapy. 7 were improved and 2 had no improvement. The aim of the study was to evaluate the effect of sleeve gastrectomy per se on ghrelin, GLP-1, and PYY levels in diabetic and obese patients. The study protocol was like this. Before the operation, the patients underwent 3 days of fasting, no caloric liquids, only no anti-diabetic drugs. And then there was an intravenous glucose load. And then there was another period of 3 days of normal feeding. Then sleeve gastrectomy was performed. And on the third postoperative day, the IVGTT was repeated. So the purpose of the protocol was to possibly evaluate the effect of sleeve gastrectomy per se without the effect of nutrients on the small intestine or any weight changes. This is, which was published 2 years ago. The effect of GLP-1 is very well known and dates 30 years ago almost. And PYY has a direct and indirect effect on glucose metabolism. So all these 3 hormones which are modified by sleeve gastrectomy are affecting diabetes. The link between the vertical gastrectomy and the GLP-1, we think, may be explained like this, because the sleeve gastrectomy diminishes the production of HCl, which in turn affects the levels of the gastrin-releasing peptide, which is produced into the antrum and is important because as the vagal innervation untouched. The gastrin-releasing peptide augmenting can release also the GLP-1. Because it has been demonstrated that GLP-1 secretion is biphasic. There's an early phase which is induced by the GRP, and this is the one we are talking about, and the second phase, which is the most prominent one and the long-lasting one, which is induced by direct effect of the nutrients on the L cell of the small intestine. So our conclusion is that sleeve gastrectomy is not a simple restrictive procedure, has a specific strong anti-diabetic effect. The mechanism is hormone-mediated, and ghrelin and GLP-1 are possibly involved in this mechanism. Thank you very much.